Bone graft. Bone grafting is a procedure used to increase the amount of bone in a person's jaw. If a patient who wants dental implants does not have enough bone in his or her jaw, a dentist will perform bone grafts before implants can be put in. Grafting material may come from a patient's own bones, bone tissue from a tissue bank, mineral substitutes, or even animal bone elements. The most optimal bone grafting material is a person's own bone tissue or donated tissue. When a dental professional drills into a patient's jaw to create space for implants, bone shavings are produced. If the person has decent bone mass, the shavings can be used as grafting material. For procedures that require extensive grafting, bone from a tissue bank or other source may be needed. Following a tooth extraction, the empty socket is allowed to heal. During this time, the amount of bone will naturally decrease slightly. Grafting material is placed in the socket and the natural bone fuses with the grafting material to build mass. There are two common types of bone grafting. The first type is more extensive and is always completed as a separate procedure for patients planning on using implants. This type of grafting involves major changes to the size and shape of the dental ridge, and the waiting time between grafting and implementation is usually several months. Smaller grafts can be applied at the time implants are received. People who have generally good bone mass but need a small amount extra to cover the sides of the implants are the ones who undergo minimal grafting. In the span of just 1 decade, grafting techniques have improved enough that people who would not have been able to receive implants can now build enough bone mass to make the procedure possible. Since it is becoming more and more common, the procedure is safe. However, it is important to trust a dentist who is familiar with bone grafting and uses a reputable tissue bank. Be sure to follow the dentist's instructions for optimal healing times and good results.